The birth itself. Early life factors are very important. Having a C-section delivery versus a vaginal birth is very important because this is your first exposure to healthy bacteria. You might ask, hey doc, what's this whole dysbiosis thing about? Well, studies have shown that dysbiosis is present in at least 74% of individuals with irritable bowel syndrome and 80% of those with irritable bowel disease. So why is the general westernized medical community not using this term? Well, in the 1900s, a Nobel Peace Prize winner, an immunologist and longevity expert who researched on longevity of life, his name was Eli Michkinoff. And he contributed research to the residence of the microorganisms in the body and how they have a potential for normal and pathological effects on the human body. So today, let's discuss the symptoms, the diagnosis, and the harmony way of treating dysbiosis. Dysbiosis is referred to an imbalance in the gut microbiome, where harmful bacteria, fungi, and yeast outnumber the beneficial microbes that we have. This imbalance can lead to systemic health concerns and beyond just digestive symptoms as well. It may include things like bloating, it may include gas, abdominal discomfort. It may also include things like diarrhea. Outside of that, some people may experience things like food sensitivities or food intolerances, fatigue, or brain fog, issues with your memory, or maybe things like skin issues or acne, eczema, psoriasis, like joint pain or inflammation. There are many different symptoms, and a lot of times we have not connected those dots yet because we're trying to treat each symptom instead of finding the root cause. Now, what are some of the causes? The causes could be dietary factors. The factors could be things like a high sugar or a high processed food intake in your diet. It could be something like a low fiber diet. Somebody told you to come off of all of your fiber. It could be excessive alcohol consumption that has a major role in dysbiosis. It can also be things like artificial sweeteners or food additives, which are growing rampant in our society. Guess what? Your food, it should expire. If not, it probably has food additives and flavorings. Some of the other things that may be causing it may be things like medications, antibiotics, which both kill your healthy bacteria and your bad bacteria at the same time. It could be things like proton pump inhibitors or PPIs, maybe some acid reducing drugs. It may be NSAIDs like non-steroidal anti-inflammatory drugs, which are trying to decrease inflammation. Reflexively, they cause more inflammation in the gut. Or it can also be medications like steroids. Now, what are some other things that can cause dysbiosis? Of course, it could be things like infections or inflammation. You may be dealing with a bacterial, viral, or fungal infection. You may be dealing with things like SIBO, a small intestinal bacteria overgrowth. You may be dealing with things like chronic gut inflammation and infections, or leaky gut, or of course, irritable bowel disease. Another cause that's overlooked often is things like stress factors or lifestyle. Okay, so if you're living in a life of chronic stress, this can alter the motility of your gut and your immune system as well. If you have poor sleep quality, if you have lack of physical exercise. Another thing to think about is environmental toxins and chemicals. Something that we overlook all the time is the exposure to pesticides. Some patients come to me and they say, hey, I'm eating a healthy diet, I should feel better. Well, a lot of times that healthy diet does have pesticides, and you may also be consuming harmful metallic chemicals and things like that, industrial chemicals, pollutants, you run the gamut. There's all sorts of chemical exposures. Another cause could be birth itself. Early life factors are very important. Having a C-section delivery versus a vaginal birth is very important because this is your first exposure to healthy bacteria. Okay, and then lack of breastfeeding. And of course, early antibiotic exposure. So we've talked about some of the causes. We've talked about some of the symptoms. It's very important to know how we can actually diagnose dysbiosis. Now, you may be wondering, why does my primary care not traditionally order a lab for this? And the truth is, the labs, they're out there. The labs are typically not conventional labs that are traditionally covered under your insurance. However, it's all the more important to have these assessed. Now, a functional medicine provider is going to use the various tools that we have to assess your gut health. Some of those tools may include things like a comprehensive stool analysis. This is unlike your traditional stool analysis in that it identifies microbial imbalances, pathogens, digestive enzyme deficiencies. We may also order things like an organic acid test. Organic acid test goes a long way for helping us to detect metabolites of the bacteria and the fungal overgrowths that may be taking place as well. Now, some of the other things that we may use at our disposal in functional medicine are things like a SIBO test. A SIBO breath test is very important. It's looking for a small intestine bacteria overgrowth. Now, another test that we may do may be something like a food sensitivity testing. Okay. Now, your food sensitivities are very important. They're not quite like your food allergies. They're sensitivities. And these sensitivities, they may be triggering a immune response in your body, and they may be responsible for your dysbiosis. Now, what's another thing that we can use to test? We can use your blood work. Of course, you have inflammatory markers that may tell us a little bit more about where you're having inflammation in your body. And we also have blood tests that will tell you about your nutritional deficiencies that are all the more important. Now, you may ask, Dr. Cooper, we talked about the causes, we talked about the symptoms, we also talked about the diagnostics. What is the Harmony Way? Well, I'll tell you exactly what the Harmony Way is. A functional medicine approach follows a 5-pronged system to restoring the gut balance. The first prong of this system is to remove the pathogens and the irritants. We need to eliminate the processed foods that are in your diet, the sugars, the inflammatory foods, the glutens, the dairies, the soy. We need to use antimicrobial herbs oftentimes to help you to get rid of the unhealthy bacteria while sparing the healthy bacteria. And we need to address the potential infection that may be taking place, whether it's H. pylori, whether it's candida, whether it's parasites. The second prong to this system is we want to start to replace. We want to give you digestive support. This may include supplements like digestive enzymes and or stomach acid, if there's a deficiency there, of course. And we might also want to support your pancreas with pancreatic enzymes. And then now it's time to re-inoculate the gut bacteria. Now we want to restore all the good stuff. Okay. So the third prong is to re-inoculate with high quality probiotics. We want to give you things like prebiotic fibers, which actually help feed your healthy bacteria, like inulin, like resistant starches. Now, the next phase of this prong system, this fourth phase, is called the repair phase. We want to heal the gut lining. We want to nourish your gut with things like L-glutamine. We want to nourish it with things like zinc, collagen, aloe vera. These are anti-inflammatory, and those compounds like quercetin and turmeric, they go a very, very long way at healing the gut lining. Last but not least, number 5 is going to be rebalancing. It's time to rebalance. Your lifestyle has to change. Your lifestyle has to evolve. We want to help you with your stress management, giving you breathing exercises, okay, giving you meditation drills. We want to help you with the quality of your sleep. And of course, we want you to exercise. Your results will only last as long as your habits. So it's very important that we start today and that we maintain our healthy habits over the long run. Hey, this is Dr. Cooper talking about dysbiosis. If this is the kind of content that you want to see, please like and subscribe below. Or you can leave a comment and ask us some questions about some of the things we shared. We would love to know about what works for you and what has worked for your family. We'll see you next time. And once again, as always, this is the Harmony Way.
And Harmony chiropractic and functional medicine, cultivating a climate for wellness.